Hello, welcome everybody. I'm Oliver Ernst, practitioner from Chinese medicine for more than 10 years, specialized in fertility treatment, and a certified Hunyuan practitioner from Barcelona, Spain. Today I have the honor to have with me Dr. Yaron Seidman from Connecticut, USA, founder of the Hunyuan fertility method, where we're going to talk a little bit today of. This is a kind of fertility method which is gaining much more popularity throughout the whole world as an alternative to IVF and ART treatments. And today we talk about this Hunyuan method with Dr. Seidman. Welcome to meet you. Hello, Dr. Yaron Seidman. How
Hi,
are you today in
hey here.
Connecticut?
Great, everything is great, thank you.
Ok, perfect. Bueno, también para nuestra audiencia española, buenos días. Soy Oliver Ernst de Barcelona, España, practicante de medicina china especializado en tratamientos de fertilidad desde más de 10 años. También soy practicante del método Hunyuan, que es un método de fertilidad, una alternativa a los convencionales tratamientos de técnicas de reproducción asistida, y hoy tengo el honor de estar con nosotros el fundador de este método, Dr. Yaron Seidman de Connecticut, de Estados Unidos, y vamos a hablar un poquito hoy de ese método de Hunyuan, que es un método muy especial y bueno, tenemos el honor de tenerle hoy con nosotros. Pues buenos días, Dr. Seidman, ¿qué tal va todo?
Mm.
Bien, supongo.
Mm.
Pues bien, pues empezamos con la primera pregunta. Just start with the first question, which is an obvious question to do. What is Hunyuan method about? What is Hunyuan medicine about? Just can you explain us a little bit about this method? Empezamos con la primera pregunta, que es la primera más obvia. A ver, ¿de qué trata realmente el método Hunyuan? Pues damos la palabra al Dr. Seidman.
Okay, well, it's a very simple question, but the answer, of course, is not so easy to give. But if I want to summarize it just in one or two sentences, the main issue in Hunyuan is that we are looking for a true principle. We are looking for something that is very truthful. And the reason we do that is because we believe that we are patients ourselves. Our wives, our children, our brother, sister, mother, fathers, they're all patients. It's not just that we are doctors and we have customers, but rather we believe that we need to find the truth because at the end the medicine comes to ourselves. So our patients, we view our patients as a family, and we also treat our family. And this is really what is characteristics of Hunyuan, to be very truthful, and we'll talk about it more today, I think, in the interview.
Bueno, esa es una pregunta un poco difícil de responder porque es de gran envergadura, pero resumiendo un poquito lo que realmente significa el método Hunyuan, nosotros como practicantes estamos intentando, indagando realmente acerca de encontrar un principio verdadero. Creemos que nosotros, como terapeutas, como practicantes de la medicina china, en primer lugar somos también pacientes y hemos de considerar a todos nuestros pacientes como a nosotros mismos. Es decir, que por ello queremos cada vez más profundizar en ese principio verdadero para poder llegar cerca a él. Bien, seguimos con la segunda pregunta. Just following up with the second question. And what differed the Hunyuan method from modern Chinese medicine? Because we do hear from antique Chinese medicine when we listen to different practitioners. Some says, yeah, look, I'm a very ancient Chinese medicine practitioner. There are other Chinese medicine practitioners say, no, I'm practicing modern Chinese medicine. So I just want to know, and what differs Hunyuan method from modern Chinese medicine? Quería preguntarle al Dr. Seidman de qué diferencia hay entre un practicante que practica la medicina china moderna y la medicina Hunyuan, porque hoy en día también hay diferentes tipos de medicina china, los que se practican más a una medicina china basada en los clásicos, otros que se basan más en principios, digamos, modernos. Entonces la pregunta principal aquí es en qué diferencia el método Hunyuan de la medicina china.
Well, The way I see it today, there are two schools of Chinese medicine, if I could say that, like two big categories. One is called classical Chinese medicine, the other is called modern Chinese medicine. Oftentimes, they designate themselves as TCM, or traditional Chinese medicine. And I think that the Hunyuan kind of fall outside the scope of these two groups. So in reality, the modern Chinese medicine, they are very pragmatic. They like Western medicine a lot. They follow Western medicine kind of thinking. And classical Chinese medicine like to read a lot in the classics, in the ancient books, and find the ideas in the ancient times. And Hunyuan kind of scrutinize both of them. Meaning, in our course, when we study Hunyuan, we study a lot of classical Chinese medicine. We also study Western medicine and modern medicine. But at the end, what we are after is true principle. So if in classical ancient texts 50, 60, 80, 90% of it is wrong, we don't want it. We only want the 10%, what I call gold treasure. And likewise with modern Chinese medicine or Western medicine, if we feel a lot of it is wrong and erroneous, we don't want it. But if there's a little bit of it which is precious, we do want it. In that respect, Hunyuan falls outside of this romantic school that believes that the ancient text knew everything and everything that is written in the ancient text is really good. And we also don't follow the modern medicine that say Western medicine knows a lot and we follow everything that they have to say. We scrutinize everything. And this is really what's typical of Hunyuan. We feel that the patient is like our family. And so we have great responsibility to scrutinize everything, meaning to be critical of everything, modern medicine, classical medicine, because we really want to find the truth. And this is kind of what makes Hunyuan a little bit unique.
Bueno, lo más importante, resumiendo, voy a empezar un poquito por el final, es que en Hunyuan sí que estamos siempre buscando la verdad, la auténtica verdad, para poder tratar al paciente, que en muchos casos también somos nosotros mismos como pacientes, podamos darle el mejor tratamiento posible. Ahora volviendo al principio de la respuesta del Dr. Seidman, pues actualmente la medicina china se conocen dos ramas, una rama que es la rama antigua, que se basa en los estudios de los antiguos, de los clásicos, y luego existe la medicina china moderna, lo que hoy en día se conoce como medicina tradicional china, que en realidad es como un híbrido que se ha creado, que no que una medicina tradicional china tal cual como la vemos ya no existe en ese sentido, sino lo que hace la medicina Hunyuan es tanto de la medicina tradicional china, es decir, de los aspectos modernos, como de los aspectos antiguos de los clásicos, ponemos a escrutinio todo lo que se dice en ese tipo de escuela. Es decir, que en una escuela que podemos decir que es un poquito más romántica, la escuela antigua, y a la escuela más pragmática, que sería la escuela, digamos, de medicina china moderna. No nos creemos a priori todo lo que nos dicen los clásicos, ni tampoco nos creemos lo que nos dicen de la medicina tradicional moderna, sino lo que hacemos es ponemos al estricto escrutinio esa información, más o menos el 80-90% lo descartamos y nos quedamos con ese 10% de verdad que hay detrás. Y es esa verdad que hay detrás tanto de la escuela antigua como de la escuela moderna la que nos apropiamos y la que hace diferente que nuestra medicina sea más cerca al principio verdadero a lo que queremos llegar. Entonces, no hay nada más auténtico que un tratamiento verdadero que queremos ofrecer a nuestros pacientes. Y recalco este aspecto otra vez, que ese aspecto que nosotros mismos, en primer lugar, somos pacientes, por eso lo consideramos como nuestra familia también. Pues vamos a seguir con la entrevista, que se prevé muy interesante. Just following up with the next question. We're going in deeper and deeper. What's the main difference then between Chinese medicine and Western medicine? Pues, ¿cuál es la principal diferencia entonces entre la medicina china y la medicina convencional, la medicina alopática?
If we just set aside for a minute the classical school of Chinese medicine and modern school of Chinese medicine, really what's the difference between a Hunyuan kind of medicine and Western medicine? I would say the following, that we feel that the Western medicine is narrates more the second half of the story, what we call the second half of the story. Rather, it thinks, it believes that the body is already alive, this is already self-explanatory, and that's it. And then we just need to explain the body, the organs, the tissues, all the physical body. If it's fertility, then it's the ovaries, the uterus, and the hormones. But rather in Hunyuan, we realize that there is a first half to the story, which is about life. What is life about, and how does life comes about? Meaning, how does it work? What's the true principle that life is working? And this is really the difference between Hunyuan medicine and Western medicine. We want to understand about life. What does it take to have life, and then how to make it longer, and that's how we come also with the information about how to make it healthier. And we don't really just dealing with the second half of the story, which is the physical body. So this is really the difference between Hunyuan medicine and Western medicine.
La principal diferencia entre el método de Hunyuan, dejando fuera o de lado momentáneamente la medicina china antigua y la medicina china moderna, si no solamente nos contemplamos y nos enfocamos al método de Hunyuan, es que nosotros contemplamos la primera mitad de la historia, que significa que nosotros tratamos de explicar de qué trata la vida, mientras que la medicina convencional trata de explicar o cómo funciona el cuerpo físico, que sería la segunda mitad de la historia. En este caso, por ejemplo, miran en caso de la fertilidad, un mal funcionamiento ovárico, qué pasa con el endometrio, el FSH, etc. Entonces nosotros en medicina Hunyuan contemplamos la primera mitad de la historia, que trata realmente acerca del principio de la vida, cómo surge la vida, cómo es que un cuerpo muerto, o digamos un vaso muerto, también se puede convertir en un cuerpo vivo. Es decir, que qué es la vida en realidad. Y indagando acerca de este aspecto, pues somos también capaces de cada vez más entender la problemática que se pueda presentar. Pues, as a patient, how do I recognize a real Hunyuan practitioner? Como paciente, ¿cómo puedo reconocer a un practicante del método Hunyuan?
Well, there are a couple of things. I mean, first of all, Hunyuan practitioners or certified Hunyuan practitioners, they do the Hunyuan certification course, which is a 6 months long course, but we study a lot in it, classical Chinese medicine and all kind of thing related to fertility. So this is the first more superficial way to know if someone is a Hunyuan practitioner, if he did the Hunyuan certification course. But in reality, what we study in the course, or what I try to teach, and this is very unique to the Hunyuan style of medicine, is really not something that I do and I want everyone else to do, but rather I want everyone to be able to think for themselves, like how to practice medicine, how to distinguish false from true, right from wrong. And this is really the process that me myself have been on for many, many years. And this is typical for Hunyuan. Now I feel, many practitioners who study Hunyuan not necessarily have the spirit of Hunyuan. For me, myself, the spirit of Hunyuan is always to be like on the edge of the cliff. Like the medicine is very, very important because I'm going to apply it at the end to myself and my own family, and likewise to my patients. So it's not like that we really study something and then we graduate and we know it. The only thing that real Hunyuan practitioner gets is a study fever. Like he has always to study feverishly to get better, more closer to a true principle. And this is really what sets it apart. Now, how do a patient can recognize it? How do they know who's the real Hunyuan practitioner? I've designed the Hunyuan Patients course, which at the end of this interview I also prepared a slide with information. Because I believe that patient needs more power, and knowledge is power. So the more patients know about Hunyuan principle and how life works and what does it mean, unification and all kind of things we'll talk about possibly today in this interview, the more they have the tools to know that when they go to a practitioner, the practitioner is also versed in this information. He knows that. He understands what unification separation is and the meaning of Hunyuan. So this is really the best bet of how to recognize a Hunyuan practitioner, is to first know yourself a little bit about Hunyuan and its principles, and then when you talk to the patient, to the practitioner that is, you have a common language. Like oftentimes patients come to me and they say, yes, I feel that in this week my unification increased. Of course, if they didn't have knowledge, they wouldn't be able to say that. They don't know what's unification unless they study it. So this is really the main recommendation. How to recognize practitioner, you study yourself a little bit at least, and then you can talk to a practitioner and know who is a Hunyuan practitioner.
Bueno, en primer lugar, un practicante de Hunyuan es un practicante que haya estudiado medicina china y luego, por obvias razones, que también haya completado la formación del método Hunyuan. En esa formación nosotros estudiamos concienzudamente los clásicos, ponemos a escrutinio los clásicos, seguimos estudiando todo lo que acerca de la vida, todo lo que acerca de los libros clásicos de la medicina china, independientemente lo que sea desde la escuela romántica hasta la escuela moderna. Seguimos poniendo toda esa información a escrutinio para poder llegar a ese principio verdadero que nos permite tratar a los pacientes de una forma más coherente y de una forma como nos trataríamos a nosotros mismos. En este sentido también hay muy poca margen para el error, ya que si considero que un paciente ha de ser tratado como yo mismo me trataría a mí mismo, a mi familia, pues evidentemente pues me tengo que esforzar a estudiar, a entender acerca de la primera mitad de la historia, es decir, de qué trata la vida, cómo puedo yo promover a la vida. Y en ese sentido nosotros tomamos como parte fundamental el hacer aprender, o digamos que el propio paciente aprenda acerca de ciertos digamos, principios del método Hunyuan. El Dr Seidman ha creado un curso especial para pacientes. Este tiene un fin para darles un cierto poder también a los pacientes, que ellos entiendan qué es lo que les pasa, qué significa cuando hablamos de unificación, cuando hablamos de separación. Entonces, en ese sentido, pues el poder del conocimiento es algún dato, no solamente algún dato, sino que es una parte fundamental en el método Hunyuan. De esa manera, cuando ya el paciente viene a un practicante de Hunyuan y habla, mira que esta semana se me ha aumentado la unificación, pues encontramos un mismo lenguaje que evidentemente si no hubiese habido esa información o esa educación hacia el paciente, pues sería imposible. En cuanto se puede establecer digamos, un diálogo a ese nivel y un practicante de Hunyuan también pueda responder fácilmente a todas esas preguntas que un paciente le pueda hacer, pues evidentemente pues estamos ante un buen practicante de Hunyuan. No todos los que hacen el certificado de Hunyuan en los ojos del Dr. Seidman son buenos practicantes, porque se necesita un cierto fervor de estudio, un fervor para llegar a esa verdad, para poder tratar cada vez mejor a uno mismo, a sus pacientes. Pues muy bien, yo creo que es una parte muy interesante y nos estamos adentrando en cosas aún más interesantes que supongo vamos a hablar hoy. Well, I think we are talking about very interesting items today, and probably are going much more deeper right now. And was one of my questions, the following question is, the Yellow Emperor says, just citing a little bit the classics, the men of antiquity knew the Tao. They followed yin and yang, and so they lived up to 100 years, and then they departed. Nowadays, almost everybody has heard about yin and yang energy. Many practitioners are talking about yin yang, and mostly all of the practitioners, they think that they fully grasp the meaning of it. But in your opinion, why is it so important to fully understand yin and yang? And what's the real message behind the say of the Yellow Emperor?
I just lost your sound there.
You lost my sound? You hear me now? You got the message? The
Yes,
question?
yes. Do you want to ask it in Spanish then?
I'm gonna ask it in Spanish, yeah. El emperador amarillo dice, los hombres del antaño conocían el Dao, seguían el yin y yang y vivían hasta los 100 años y entonces fallecían. Hoy en día casi todo el mundo ha oído hablar del yin y yang y muchos practicantes, pues evidentemente de la medicina china, creen que han comprendido completamente ese conocimiento, o digamos ese principio, ese concepto del yin y yang. En su opinión, ¿por qué es tan importante entender completamente el concepto del yin y yang y cuál es el mensaje real detrás de ese dicho del emperador amarillo?
Okay, well, I mean, for the viewers who don't know, the Yellow Emperor is like one of the earlier classics of Chinese medicine from 2000 years ago or so. And this quote is from the first chapter, and the first chapter shows a great importance that the medicine in that time emphasized on yin yang, this description, that the men of ancient, they knew yin yang, etc. I think yin yang is one of the fundamental principles of Chinese medicine and is of utmost importance. And for us in Hunyuan, which when we are actually never satisfied with any answer, we keep on researching more and more. We find that, at least I personally find that, in a classical kind of Chinese medicine, there's a lot of mysterious thing going on, meaning life is very mysterious, and in a sense it is mysterious. Where are we coming from? Where are we going to before we're born, after we die, and all kind of topics. Why is life going on? Classical Chinese medicine deals with that a lot. On the other hand, when you deal a lot with mysticism, things that are mystical, that you can't see them, you can only trust the text. The men of antiquity, they said it, and then they probably knew, we don't know it. And this is something in Hunyuan we don't accept, we don't take for granted. On the other hand, when you talk about modern kind of medicine, which is very pragmatic, like Western medicine, very practical, they say, well, forget about all the mysticism, as if it does not exist at all. We just want the practical things. So yin yang is like hot cold, it's like day and night. It's like all the things that are visible to the eyes. Like there's nothing beyond, and in a sense it's much like Western medicine. There's nothing beyond, it's all what you can see. It doesn't matter if you see it with microscopes or whatever, but it's all what's physical and visible. And where classical, more Chinese medicine say, no, everything is invisible, you can't see anything, and because we can't see anything, we just take it for granted, what the sages said, because they knew it. So for us in Hunyuan, we kind of don't believe either one of them, but rather we try to understand a little bit of this mysticism. We also want to try to understand a little bit of this practical, but in reality we realize that in between, what connects between the very root of things, which is in mysticism, and the very manifestation of things at the end, which is at the outside of things, there's a whole process in between that we call yin yang. And actually this process in between is what we call the main rope, or the main issue that involves human life. This is the real business of medicine, to understand not the very mysticism of things that nobody can understand, nor is it just to know the manifestation of it and then not know anything behind it, but rather we need to know the first half of the story, or like what's in between, all this information in between. This is really the research that we do in Hunyuan, for in any aspect of medicine, but especially in understanding yin and yang. So I want to bring one example. For example, like let's talk about something we can all relate to. Let's talk about ovulation. What we call ovulation today in modern medicine. So if I would ask a modern practitioner what is ovulation, they will say the egg is being released from the ovary. This is ovulation. If I would ask a classically trained practitioner, what is ovulation? They will say an egg released from the ovary, because in ancient time we don't have the concept of ovulation. So we both fall on this Western medicine because we're missing the first half of the story, or all the story in between the origin and the manifestation. This is the story of yin and yang. So for us in Hunyuan, we look at ovulation, we see Western medicine with a microscope and telescopes and whatever they can see inside the body with all kind of scopes, and we see an ovulation, we see an egg discharged from the ovary and then being fertilized and can get pregnant. But we also know the roots of mysticism, how life starts and how it connects to nature, and what we need as a Shao Yin energy and recharging instrument we'll talk about later, possibly in this interview. And then we realize that ovulation is actually a split, a pivot split. In order to live, one needs what we call a pivot fire. In the Hunyuan patients course, of course, we have much more time, and I talk about it quite a bit more. Today we don't have that much time, but we have what we need, pivot fire, in order to be alive, to have what we call the vessel, or the dead vessel, to be alive. In order for our body, our physical body, to be alive, we need pivot, a pivot fire, and in order to have that, we need a Shao Yin recharging instrument. And then when you have an ovulation or an egg is discharging, what actually happens is the Shao Yin instrument or pivot fire is splitting, and there's a small piece of it. The egg itself is not just a piece of material, but rather it has some pivot fire in it. That's why it can make new life. If you just take a piece of skin, you can't fertilize it. There could be no embryo. But if you take an egg, an ovum, a female ovum, it has life pivot in it. So we know that it splits for the mother's own pivot, and then you can create a new life. So again, to go in depth into this topic, we have the Hunyuan Patients course, but here I just want to bring an example to show you that we don't shy away from classical Chinese medicine and its understanding of life, how life is working. We also don't shy away from Western medicine and knowing that an egg is discharged or being split, broken from the ovary in order to fertilize, and we actually push it further to make it closer to a true principle. So we're not afraid of Western medicine, we criticize it, but we take what we think is good. Likewise with classical Chinese medicine, we study a lot of it, but we only take the good things. At the end, we merge them to make our Hunyuan medicine. So again, was just an example to understand yin and yang. Again, when we understand yin and yang, it's the process of unification, separation. We'll talk about it more, but this is really the true understanding of yin and yang, and we'll talk about it later.
Thank you very much. Try to sum it as much as possible. There was a lot of information in this answer, and a lot of information also in the question. So I think this is a crucial one to understand what's Hunyuan about and where we can go to. So, creo que es una pregunta y tanto una respuesta también muy importante para realmente poder entender hasta dónde podemos llegar en nuestra medicina Hunyuan. El concepto yin-yang es algo fundamental en la medicina china. Pues bien, en primer lugar, para los que no conocen el emperador amarillo, pues se trata de una cita del primer capítulo del emperador amarillo en el cual pues se hace esa citación. Nosotros en medicina Hunyuan, pues evidentemente no nos asustamos de lo que dicen los clásicos, tampoco nos asustamos de lo que dicen desde la medicina tradicional moderna. Sin embargo, pues hay que entender un par de conceptos. Desde el punto de vista la escuela romántica, pues la escuela de los textos antiguos, etcétera, etcétera, pues que entraña un cierto misticismo. Y pues ese misticismo para mucha gente pues que es incomprensible. Evidentemente hay que indagar muy profundamente en ello para poder extraer alguna verdad de ello. Nosotros evidentemente pues ponemos a escrutinio ese tipo de información que hay ahí dentro y nos quedamos con una parte que nos puede interesar. Desde el otro punto de vista, la medicina moderna, la medicina tradicional china moderna, dice que yin y yang no hay absolutamente ningún misticismo detrás, sino que es todo muy pragmático. Eh, yin es la noche, yang es el día, yin es el frío, yang es lo caliente. Entonces, ¿qué misticismo hay ahí detrás? Que eso se entiende perfectamente y no hay nada oculto detrás de esta información. En realidad lo que ocurre es que nos interesa el pequeño espacio que hay en medio de esas dos verdades. Es decir, que sacamos una verdad de lo que es la parte de los clásicos, sacamos otra verdad de la parte de los modernos y es ahí donde realmente hemos de penetrar para poder llegar a la principal cuerda y no solamente contemplar lo que sería como el final del hilo de la cuerda. Siempre nos ocupa la parte fundamental, de dónde surge la vida, cómo surge la vida, cómo puedo yo explicar a la vida. Y eso es fundamental, entender el yin y el yang para poder dar respuestas a ello. Si ahora somos un poquito más pragmáticos, para que nos entendamos todos, si ponemos un ejemplo como la ovulación, si preguntamos a un practicante de medicina china tradicional que dice que yo estoy practicando según los clásicos y por eso, como yo ya practico según los clásicos, entiendo muy bien el yin y el yang. Si le preguntamos, a ver, ¿qué pasa en una mujer que está ovulando o qué es la ovulación? Pues evidentemente nos dirá pues, un óvulo descargado por el ovario mensualmente. Si hacemos esta misma pregunta a un practicante de medicina china moderna, nos va a dar la misma respuesta. Es decir, que en realidad no hay nada escrito al nivel de medicina china sobre los fenómenos de la ovulación. Si ahora nos basásemos en esas dos vertientes, tanto de la medicina china antigua como de la medicina china moderna, pues deberíamos dar la misma respuesta, pero como en Hunyuan sí que ponemos a escrutinio esa información, hemos de ser muy estudiosos para poder llegar a ese principio verdadero, a esa verdad que queremos extraer. Pues bien, si contemplamos otra vez que la primera mitad de la historia, que es de qué se trata la vida, pues hemos de ser conscientes que existe un instrumento en el cuerpo que nosotros llamamos el instrumento Shao Yin, que es un eje de fuego que conecta dos órganos o dos meridianos o una entidad, digamos, nosotros lo llamamos Shao Yin. Esto viene de la escuela clásica y de hecho es la esencia más importante que existe de la medicina clásica. Se llama Shao Yin, eje de fuego, la ovulación. Entonces, la ovulación, cuyo significado viene de la medicina convencional, en realidad pues, se trata de un proceso de escisión o de ruptura. Algo se rompe, algo se escinde. ¿Qué es lo que se rompe? ¿Qué es lo que se escinde? Pues evidentemente hay esa ruptura del eje Shao Yin. Hay una ruptura del eje Shao Yin durante el óvulo. Y el óvulo físico no solamente lo contemplamos como un trozo material, sino sería imposible que pudiese generar una vida nueva. Es decir, que en esa ruptura se rompe un trozo de este fuego de Shao Yin, de este eje de Shao Yin, que ya en sí mismo entraña la posibilidad y la capacidad de generar una nueva vida. Nosotros lo llamamos un eje independiente, el eje de fuego que se separa de la madre, y entonces una vez que se ha separado de la madre esa parte, pero claro, el ovario en sí mismo y el óvulo, digamos, tampoco nos sale fuera del cuerpo, ¿sí? Sino permanece dentro del cuerpo, dentro de su cuerpo físico. Eso, por supuesto, tiene muchísimos más temas implicados. Por eso el Dr Seidman ha también creado un curso para los pacientes donde ese tipo de información se explica en más profundidad para los que se interesan o quieran estudiar, entender más acerca de estos fenómenos, puedan, pues evidentemente, poder escucharlo, estudiarlo. Resumiendo, y así acabo, es decir, que nosotros no rehuimos de toda la información de los antiguos, ni rehuimos de la información o de los conceptos de la medicina china moderna, sino que buscamos los puntos fuertes de ambos. La meta es la misma, en Hunyuan queremos alcanzar un principio verdadero, siempre volvemos a lo mismo, es decir, que ese principio verdadero que nos permite entender la vida, de dónde surge la vida, de dónde nace la vida, desechamos, digamos, los conceptos erróneos y nos guardamos como un tesoro verdadero lo que es correcto, lo que es verdadero, lo que nos lleva a este principio verdadero. Bien, creo que ha sido muy interesante. Hasta ahora seguimos con la entrevista. Well, I think it was quite interesting this kind of information. We'll just go on following with the next question. Just let me have a look where I am. So, what's the most important virtue to become a good Chinese medicine doctor practicing the Hunyuan method? ¿Cuál es la virtud más importante para convertirse en un buen médico chino practicando el método Hunyuan?
Well, I think the most important, and thank you for this translation. I couldn't believe that I spoke so much with the answer, but thank you. The Spanish language, it just sounds so beautiful. In any case, I think what's really the most important is to be able to scrutinize all the time, to criticize all the time. The practitioner needs to feel, as I said before, as if he's standing on the edge of the cliff. Very, very careful, can do mistakes all the time. And because of that, because we are very, very worried of doing mistakes, we study very, very diligently all the time, feverishly want to get better and better, closer and closer to the truth, so we don't do mistakes. At the end, the mistakes are for my own children, my wife, myself, my family, and my patients, of course. So it's nothing about, getting certified or licensed and then practicing and be happy, making money, but rather we always worry to make a mistake, and that's why we study really hard. This is a good quality. And if I may, I just want to share a short story from this week. Normally I share stories from my clinic to make it real life, what I experienced. So this week I had a patient, one of my students in the Hunyuan course. His grandmother was really sick, and he asked me if I can see her, and she's like in a different country, far away. So we did it online and see her, and I saw what kind of a problem she has, and which was very, very difficult. And I said, okay, I'll make you a formula and I'll send it to you, but it's going to take a few days until you get the formula in the international mail. So in the interim, I said, go to Chinatown, your local Chinatown, and try to get some other herbs, what we call mild herbs. In our language, in Hunyuan medicine, we call them carrots and bananas. Like very mild herbs, not so medicinal, but just something to carry you until you get my herbs in the mail. Because real potent herbs, we don't really buy in local Chinatown stores. The quality is too inferior. You can't use them. Sometimes they become dangerous if they're not the right quality. So that's why I told her just to get some carrots and bananas kind of herbs in the interim. So, and these are all Chinese people. The mother, the grandmother, they're all Chinese, very traditional. So they went to Chinatown and they saw the storekeeper, and the storekeeper looked at my formula, and this is the carrots and bananas formula, not the real formula that's in the mail. And the storekeeper said, oh no, you can't take this formula because the dosages are too high, 30 grams, 40 grams. In the modern kind of Chinese medicine, they only give 10 grams. We call them 10 grams doctors. And so in any case, they convinced the mother not to give her my formula, nor the formula that's in the mail, and if not even the carrots and bananas formula. So this is a kind of, because that practitioner, she referred her to a local practitioner who used to be the second in command in a hospital in China. So like, it looks very impressive. He was in a hospital, the lieutenant for the manager of the hospital, and I don't know what. So he gave her a formula. The grandson sent me the formula. Like it is a disaster. And the grandmother, it's her bad fortune that the practitioners, they don't really scrutinize and learn really hard to know right from false. It's like they're all very happy to be a professor in the hospital, etc., and the business is already flowing, and they don't care about really the impact. So this has just happened this week, so we're not really sure what's going to happen. But I can tell you that a similar case happened to me a year ago with an old man, and I told this story before, was just about to die. He looks like he's going to die any day. And his son was a senior physician in a hospital, and they couldn't find anything, so he came to me, and I gave him herbs for 2 months, and that revived him back. And just 2-3 weeks ago, I went to visit with him in Pennsylvania, and the father, even though in the interim had also back surgery, is doing quite well a year later. He just took herbs for 2 months, and he's well a year later. And everyone were convinced that he will die any day, a year ago. Now this grandmother that I just spoke about wasn't that lucky. She met other practitioners that convinced her that it's wrong and they should take some other herbs of inferior quality in dosages of 10 grams, and this will save her. And it is a very, very sad story. So for Hunyuan practitioners, we can't allow it. I mean, in that case, the grandmother's fortune wasn't so lucky, but for us as practitioners, when patients come, we can't allow this kind of mistakes. And that's why the good quality of a practitioner is to study feverishly all the time, not to do these kind of mistakes, never to be comfortable in their chair that we know a lot. And this is really the best quality of a Hunyuan practitioner.
Thank you again. Try to do my best in the translation. Gracias otra vez. Pues intentaré hacer lo mejor en mi traducción. Pues lo principal es que como practicantes de Hunyuan ponemos siempre a escrutinio toda la información, siempre examinamos la información, no creemos ciegamente a nadie, aprendemos a contemplar, aprendemos a pensar para nosotros mismos, a examinar otra vez, a poner a escrutinio otra vez y a discernir lo falso de lo verdadero para poder llegar a ese principio verdadero del cual ya hemos hablado bastante en esa entrevista, que sigue siendo lo más precioso que tenemos. Es decir, que ese principio verdadero que habla de cómo surge la vida, cómo puedo yo preservar esa vida, porque la vida se considera algo precioso. Entonces, en ese sentido, nosotros siempre tenemos el miedo de equivocarnos, como si estuviésemos al borde de un precipicio y estamos ahí al lado de ese precipicio al borde de caernos. Entonces, como no nos podemos permitir caernos, porque si ya cometemos ese error para el paciente es como si lo cometiésemos para nosotros mismos, porque consideramos el paciente como parte de nuestra familia. En ese sentido, recalco que hay muy poco margen para el error, ya que estamos realmente muy comprometidos, estamos estudiando fervientemente cada vez más para profundizar, para entender mejor lo que estamos haciendo, y eso es lo que hay. En ese sentido, el Dr. Seidman pues, comparte siempre algunos ejemplos clínicos, que lo que le ocurre en su práctica clínica. Ha citado dos. Alguna cosa que le ha pasado esta semana con una estudiante suya, es una familia china, pues, pero parece que la abuela vive fuera de Estados Unidos, o fuera por lo menos del condado donde vive Yaron. Pues le pregunta acerca de la problemática de la abuela. Entonces el Dr. Seidman le ha prescrito una fórmula que en realidad no, pues esta fórmula prescrita tarda unos días para poder llegar a ella, porque lo tiene que enviar por correo normal. Entonces, mientras tanto, le dijo a su estudiante pues que fuese a Chinatown a comprar una fórmula un poco más suave, lo que nosotros llamamos carrots and bananas, o serían como zanahorias y plátanos, ¿no? Es que ni fu ni fa, ¿no? Porque en medicina china moderna normalmente cuando contemplamos las fórmulas pues vemos 10 gramos ahí, 6 gramos ahí, 5 gramos ahí. El Dr. Seidman pues ni siquiera hizo una fórmula pues hasta que le llegase el paquete que él originariamente había prescrito. Pues una vez que fueron a Chinatown a recoger esa fórmula, que en definitiva pues era una fórmula mucho más suave, pues al ver la prescripción, el que estaba detrás en Chinatown vendiendo las hierbas veía a ver cómo puede ser 30, 40 gramos de estas plantas, pues que esto no está bien. Pues desgraciadamente convenció a la mujer que no se lo tomase y fuera una autopracticante que era, no sé si es médico o no, pero por lo visto trabaja en un hospital, y para conseguir otra fórmula. Entonces el Dr. Seidman sí que ha recibido esa fórmula y según él es un auténtico desastre. Claro, eso no puede ser. Nosotros realmente si hemos de dar una dosis X, que sea la que sea, porque hay que aplicarla, pues hay que aplicarla y no vamos ahí rondando con medicinas que ni son ni fu ni fa. Comparte con nosotros otro caso de una persona ya muy mayor, que era el padre de un cirujano, ¿no? Un médico, pues que hace un año pues que estaba prácticamente abocado a la muerte, pues estaba como en el sentido desahuciado, decían que le quedaba poco tiempo para vivir y esta persona sí siguió el tratamiento con el Dr. Seidman después de un año, todavía sigue vivo y aparentemente en buena salud. Ahí pues vemos también que todavía no sabemos qué es lo que va a pasar o qué es lo que está pasando con esa abuela que ha ido a Chinatown, pero bueno, ahí está, la historia está ahí, está claro. Pues muy bien, seguimos, just we go on. Well, let's do, let me see about, well, I think this is an important issue also to talk about. I mean, contemplating Western medicine, conventional medicine, and our medicine, especially when we talk about infertility treatments. Let's say normally all the patients, they come with all kind of diagnosis, no? Like FSH, I have POF, endometriosis, etc. So what do you think, Dr. Seidman? Is it recommendable to mix this Western medicine and the Chinese medicine in order to make medicine work better or to get more fertile? Bien, los practicantes de la medicina china, del método Hunyuan, pues la pregunta aquí ahora, ¿es recomendable que nos centramos mucho en los diagnósticos y digamos en las apariencias, no en la apariencia, sino que en lo que se diagnostica, por ejemplo, en caso de la infertilidad, si vemos una paciente con una FSH elevada, con miomas, con endometriosis, con baja reserva ovárica? Entonces mi pregunta es que es recomendable, según la visión del Dr. Seidman, de mezclar esas dos medicinas para que funcione mejor la medicina en sí misma o para hacer que la persona sea más fértil.
Hey, so as I said before, we don't shy away from Western medicine. We love Western medicine. We especially love to criticize it and scrutinize it in order to extract out of it some good information. So we don't really take it for granted. We just try to extract out of it few pieces that are useful in order to improve our medicine. But in reality, what we are doing in Hunyuan medicine is addressing the first half of the story that Western medicine does not and cannot address. All these issues of life, what does it mean, how to create new life, Western medicine doesn't have it. It all deals with the physical body. So all the diagnoses that you just mentioned, high FSH, PCOS, or endometriosis, or whatever it may be, physical problem, all belong to the second half of the story. And the job, the task of Hunyuan practitioners is to identify the first half of the story, which oftentimes leads to these other problems in Western medicine. So if we use Western medicine as a lead, meaning their diagnosis of high FSH tells me anything, that means that the Hunyuan practitioner didn't understand anything. The Hunyuan practitioners need to be able to diagnose and understand what is the first half of the problem. Which part of the energy is not working? Is it the Shao Yin too deficient, or the Jue Yin, Yang Ming? All kind of things that are obstructed. It's before the physical body get obstructed and you get diagnosed with high FSH or anything else. So this is why I think that mixing the two together is a very bad idea. is first of all not understanding what's the difference between the first half of the story and the second half of the story, as if there's only one story. That's what Western medicine wants all patients to believe. There is only this one story. Your FSH level is elevated, this is the story. Or you're not ovulating, or whatever physical happened, this is the story. But in Hunyuan medicine, we know better. There is actually other story here that nobody talks about, and this is what we're dealing with. So if I mix them together, I actually don't understand how these two stories are separate. So oftentimes the reason we succeed in practice and Western medicine fails is because we address other things. We don't address the same thing, because Western medicine is the best in their field. It is the best in their physical medicine field. Chinese medicine is not better than Western medicine in Western medicine field, but rather Chinese medicine or Hunyuan kind of medicine is better in our own field. Western medicine doesn't have it at all. So knowing about Western medicine, scrutinizing it, getting ideas from it is all positive and good, and we do it all the time. But when it comes to practice, we have our own terminology, we have our own understanding of what the problem is, and that's why the treatment is different, and that's why many times patients succeed in getting pregnant.
Thank you again. Still trying my best with translation. Let's just translate it into Spanish now. Okay. Bien. La respuesta, en primer lugar, mezclar, según el Dr. Seidman, no es una buena idea, porque si creemos enteramente en la segunda parte, lo que llamamos nosotros la segunda parte de la historia, es decir, que en el FSH elevado, en el endometrio que no esté bien, el curso del endometrio, cualquier otra patología que pueda haber, pues según el Dr. Seidman, pues no hemos entendido nada. Nosotros lo que queremos hacer es que entender la primera mitad de la historia, que puede llegar a manifestarse en la segunda mitad de la historia. Es decir, que hemos de entender qué significa una deficiencia verdadera del Shao Yin, o si hay un problema en el Yin o en Yang Ming, que más tarde puede llevar a mostrar problemas al nivel de la segunda parte de la historia, es decir, al nivel del cuerpo físico. Pero para nosotros, como practicantes de Hunyuan, que nos centramos en el principio verdadero, que es decir, en el principio de la vida, mucho más importante es entender dónde se originó ese problema, y tenemos digamos, una dialéctica propia a la hora de tratar al paciente. Tenemos que tener esa dialéctica y esa práctica terapéutica propia para poder llegar a ese principio verdadero, y es por eso también que muchas veces, aunque ya vienen diagnosticados con, digamos, endometriosis o con cualquier otra tipología que puede impedir unos óptimos percentiles de fertilidad según la medicina convencional, nosotros cuando contemplamos la problemática desde nuestro punto de vista sí que somos capaces de conseguir un éxito, es decir, que sí que somos capaces de generar nueva vida. En ese sentido, si solamente nos centramos en la segunda parte y queremos diagnosticar la segunda parte y tratar según la segunda parte lo que nos haya dicho el médico convencional aplicando Hunyuan, en primer lugar no hemos entendido nada, y en segundo lugar no vamos a llegar a donde tendremos y somos capaces de llegar. Muy bien, seguimos con la rueda de las preguntas. Just keep on going. I just want to focus a little bit more on fertility issues. In your opinion, what's the most important cause of infertility, and in order to that, what's the most important thing to foster a good reproductive health? What can the patient do proactively to get more fertile? Hablamos un poquito más de fertilidad. En su opinión, ¿cuál es la causa más frecuente de infertilidad y, consecuentemente, qué es lo más importante para fomentar una buena salud reproductiva? Y lo que es igual de importante, ¿qué es lo que puede hacer el paciente proactivamente para mejorar o para hacerse más fértil? Adelante.
Okay, so here, we need a little bit more knowledge in order to assess this. Like in the Hunyuan patients course, we talk, of course, much more about it. But I just want to explain something to show you what we mean when we talk about the first half of the story. So first, to understand how life is working, what's the principle by which it is working, we need to understand that life moves through a cyclical motion, in cycles. It moves in cycles. And these cycles we call in Hunyuan medicine unification separation cycles. That's what happened in nature between summer and winter. Every year, summer and winter, summer and winter. Everything opens up and then everything goes into storage in winter. This happens into our body every year, every day and night. When I go to sleep, my body goes into a unification mode. If you look at me, I'm just demonstrating it. I'm lying like this, not moving, as if I'm dead. I'm not really dead, but as if I'm dead. If you talk to me, I'm not answering. If you give me something to eat, I'm not eating. I'm not doing anything. This is called a state of unification. And then I go out of this state of unification into what we call a state of separation. I start to live. I eat, I write, I talk on the phone, I come here to do this interview. This is called a state of living or separation. And like this, we move every day and night, every day and night. And the reason that we do it, and that's a question Chinese medicine asks itself, why do we go to sleep at night? Why do we do this unification? Because we don't do anything. We don't read, we don't talk. Why do we waste this time? We could have do other things, write a book or do something. But in reality, it is necessary to go into unification, because this is what we call in Chinese medicine a recharging. We use our energy during the day, we spend it, then we get tired, then we go to sleep to recharge. We recharge, we wake up tomorrow, energy again. We are energetic again, alive again. If we don't do this recharging actions every day, then of course our life becomes very short. And that includes other aspects of our life, breathing, eating, drinking. They all belongs to this recharging activities and more other levels that we don't have time to go into right now. But this recharging activities is something that is vital to our life, and the way we use it is we have this what we call a Shao Yin instrument. So in other words, let me just take it a step back. We do this recharging activities every day, every night, when we go to sleep, when we eat and drink and breathe. But as we grow older, even though we still eat and drink and sleep, our body declines. It doesn't take enough energy from it. Like I don't have so much energy the next day. Until the last day of me, when I can't live anymore, I breathe and the air doesn't go in. I sleep and it doesn't matter. It doesn't recharge me anymore. What happens in order to recharge for any living entity, we need this what we call a Shao Yin instrument or unification instrument or recharging instrument. These are all synonyms. Recharging, unification, they're all synonyms. It means it's my body's ability to take these things into the body to recharge. Now, the reason that I talk or give all this introduction, this piece of knowledge that we need, when it comes to fertility, when we try to get pregnant, an embryo is not a body. It's not a sperm and an egg together and that's a body. It's not a dead body. It's not a dead vessel, but rather it's a living thing. And a living thing from day one has to be able to go through this cycles, this recharging cycles. As an embryo, of course, the baby, the embryo, the fetus, the baby, recharge from the mother until it has its own vessel to go out of the mother and live its own, to eat, to drink, to breathe. But this recharging instrument starts at the beginning, not when the baby is born. So this is the Shao Yin instrument, and I have here a whiteboard I want to share with you. When we draw a circle, the bottom of the circle every time refers to the center of the body. This is where Shao Yin energy and the unification instrument happens, also with the kidneys and the heart. That's where the unification happens. The top of the circle that you can see here is the separation instrument, meaning that's where the energy is completely outside, at the head, at the hands and legs. This is when the energy is outside. But the Shao Yin instrument, this is what helps the embryo cycle. Before we mentioned the split that happens in the ovary is this Shao Yin instrument of the mother and father joining together to create a new life, a new instrument that can cycle. So what a woman and a man needs to do in every aspect of their life in order to increase fertility is to increase this unification instrument, not to abuse it, not to decrease it, but rather to increase it. Now, how to do it, of course, we need to talk about, and the Hunyuan Patience course talks about it a lot, but this is really the main thing what needs to be done. It's not to stimulate the ovaries, which does the opposite. It moves the body into a separation mode, but rather to increase the recharging capability. This is the number one, the most important thing that any woman and man could do to increase their fertility. This is the real thing that can help fertility.
Ok, muy bien. Pues para poder responder esa pregunta que le he hecho al Dr. Seidman, pues hemos de hablar necesariamente de unos conceptos que ya son un poco más técnicos, podemos llamarlo así, dentro del método de Hunyuan. En primer lugar, hemos de entender que nosotros como seres vivos no somos aislados o no somos entes aislados del ciclo de la naturaleza. Es decir, que tenemos que converger con ese ciclo de la naturaleza. En cuanto más converjamos con ese ciclo de naturaleza, más somos capaces también de recargarnos, digamos, de esas energías intrínsecas que circulen dentro de la naturaleza. Naturaleza y, digamos, y nuestro cuerpo, por supuesto, porque nuestro cuerpo ha de estar en sintonía con esos propios ciclos de la naturaleza. Hemos de hablar necesariamente del concepto de unificación, de separación. Unificación, ¿qué significa? ¿Qué significa irse a dormir? ¿Por qué de ir a dormir y no escribir un libro por la noche, digamos? Eso tiene una simple razón, porque durante esta noche o durante la noche, cuando nos vamos a dormir y cuando estamos 8 horas durmiendo y no corriendo por ahí, escribiendo libros o haciendo otras cosas, aunque alguna gente sí lo hace, pero hay que ser consciente de que lo que conseguimos en esta franja horaria es aumentar el instrumento Shao Yin. Ese instrumento Shao Yin, de alguna manera, es la capacidad que tiene nuestro cuerpo y nuestra mente, nuestro cuerpo físico, nuestro cuerpo psíquico, de recargar nuestras pilas, recargar nuestras baterías. Es decir, que nosotros hemos de ser capaces o tenemos que recargar nuestras pilas para luego el día siguiente, cuando nos levantamos, es decir, que cuando ya nos levantamos, cuando entramos en separación, salimos de la unificación, entramos en separación, nos levantamos por la mañana, ya somos activos durante el día, la actividad, comemos, bebemos, y ya estamos activos. Cuanto más hayamos recargado esa energía en esa fase de unificación, más somos capaces también durante el día de llevar a cabo esa parte de lo que nosotros llamamos o podríamos llamar separación. ¿Qué es lo que ocurre? Normalmente con la edad la capacidad de ese instrumento Shao Yin de poder recargar las pilas, las baterías, se reduce. Y aunque dormimos, y aunque comemos, y aunque bebemos, llega un día en cuanto nos morimos, es decir, que ya no hay esa capacidad de unificación. Ahora bien, concretamente en el caso de la fertilidad, ese instrumento Shao Yin, y ahí, Yaron, can you just put on the screen again with the circle? Le he preguntado que por favor ponga otra vez el círculo. Entonces ahí vemos perfectamente que para poder regenerar la energía tanto en la mujer como en el hombre y para poder ser más fértiles, lo que hemos de hacer es incrementar esa capacidad de recarga de las pilas de la batería que nosotros llamamos el instrumento de unificación Shao Yin. Todo lo que nos hace que esa capacidad de aumento de recarga de las baterías de ese instrumento Shao Yin nos acerca más a nuestra meta de ser más fértiles. Todo lo que reduce, es decir, que mala vida no dormir, no respetar esos ciclos de la naturaleza, nos aleja más de ser fértiles. ¿Vale? Y pues, ¿qué es lo que puede hacer el paciente proactivamente en ese sentido? Pues todo aquello lo que hace o lo que haga que ese instrumento Shao Yin se incremente en todos los aspectos de su vida, pues hace pues que sea más fértil. Y todo lo que hace o haga que se reduzca ese instrumento Shao Yin, pues va a repercutir negativamente, primeramente en su salud y efectivamente y por ende en sus percentiles de fertilidad. Okay, we just keep on going. Here's another very common situation we as practitioners who treat fertility are very common with. Female patient around 40 or over 40 years, POF, several failed IVF treatments. RA says that there is a poor ovarian response and recommends to do urgently another FIP, IVF or ICSI procedure in order to achieve a result. If another intent fails, he says you can still do ovo donation, but don't lose time because you and your eggs are getting older. How do you cope with a situation like this? How can Hunyuan help in a situation like this? I mean, this is a common situation we see almost every day because they come in and see really they got a lot of pressure from the IVF clinics and also from our surroundings. Something, yeah, because you're 40, 42, and there's an issue with time. I like to focus on a little bit more on further anyway, but I think it's a good thing to introduce this concept of time due to this kind of question. So let me see where I have this question in. Si contemplamos una situación que nos encontramos muy comúnmente en práctica clínica, los que tratamos la fertilidad, prácticamente diría yo a diario, una mujer en torno a los 40 o más incluso, con baja reserva ovárica, que ya ha tenido varios ciclos de reproducción asistidos fallidos y desde la clínica de fertilidad pues le están diciendo o proponiendo que haga urgentemente otro ciclo de reproducción asistida para obtener un resultado. En caso de que no obtenga el resultado deseado, pues todavía puede hacer ovulación, pero en un caso pues dice que como ya el reloj biológico está actuando, pues que no hay que parar a encontrar una solución desde su punto de vista. Y ahí pues introducen el concepto de que, claro, tus óvulos y tú cada vez estáis más viejos. ¿Qué es lo que podemos hacer desde el punto de vista de Hunyuan? ¿Cómo actúas en una situación semejante para qué es lo que haces, ¿no? Aquí creo que introducimos un concepto que también es muy importante desde nuestro punto de vista en medicina Hunyuan, que es el concepto del tiempo. Que si puedes ya hablar un poquito de ello, si no ya pues más adelante también vamos a aclarar un poquito más. Pues adelante.
Okay, well, this issue of time, what does it mean? You're running out of time, you have no time. This is something that Hunyuan medicine research very, very carefully, and it's completely outside the scope of Western medicine. So when they tell patients you're out of time, it's just, of course, a statement that puts the patient under a lot of pressure, and we don't right now have exactly time to explore this. In the Hunyuan patients course, I explore it thoroughly. What does it do to the patient physically, how it prevents her from getting pregnant just by going under this pressure. But just answering to your question, the issue of time is actually very, very important, and the way patients should deal with that is to get more knowledge. That's what we're talking about, is to get more knowledge. What does it really mean? And as I explained to you in the previous question that you asked, the unification instrument, the stronger the Shao Yin instrument that we have here at the bottom of the circle or the center of the body, the stronger it is, the more time we have to cycle or to live, the more years we have to live. And likewise, when the Shao Yin energy is stronger, the more years or months we have to do a split or ovulation or still keep our fertility. And likewise, the egg that splits with the pivot of fire that it has in it, the more Shao Yin instrument we have, the more the egg pivot has Shao Yin instrument in it. And that makes, in our English, plain English, it means the more fertility. Now, what we really need to do, as we said before, is to get as much Shao Yin instrument strength. So everything that we do in life, and I'm drawing it here on this whiteboard, we need to do this action. And I'm drawing an arrow here, moving the energy into the center. Again, the bottom of the circle is the center of the body, moving the energy into unification to increase the Shao Yin instrument. And that includes herbal treatment and acupuncture and lifestyle and diet and exercise, doing it right. We have this information that we teach the patients in all different aspects of life how to increase unification. Not only that you should increase unification, you should also prevent doing the wrong thing. So oftentimes I tell my patients, you want to get pregnant, don't do anything, but rather you need to do the right thing, not anything. So the wrong things you don't want to do, and the wrong things as far as we're concerned in Hunyuan medicine is do this, which means move the energy out of the center into separation. This can be done with stimulating drugs like with ART procedure. This can also be done with wrong herbs in Chinese medicine. This can also be done with wrong lifestyle and exercising the wrong way, etc., etc. Different ways that you can decrease the unification and the Shao Yin energy becomes weaker and weaker. If the Shao Yin energy becomes stronger because you did the right things in lifestyle and herbal medicine and acupuncture and whatever it may be, that means that every month that goes by, to a certain degree, you become more fertile, not less fertile. But to the other hand, if you do things that decrease unification, decrease the Shao Yin instrument, you are actually running out fertility in a double speed. So this is something that we need to consider. So again, as I said before, when the doctor tells the patient you're running out of time, it put the patient under tremendous stress, and the patient feels I have to do radical actions. And in reality, I do tell patients you have to be very aggressive, but aggressive in becoming healthy, not aggressive in ruining the health. So this is something that patient can only know to tell the difference if they have some more knowledge. Like, what does it mean to have more unification? How does it look like? How does it feel like? And of course, it feels like more healthy. If you do things that decrease your health, like side effects from drugs and herbs, that includes hot flashes and night sweats or any other things, feeling swollen, bloated, all these things decrease unification and actually makes your pivot weaker and weaker and more infertile. So this is really what time has to do with it. The more Shao Yin instrument we have, the more time we have to live and to be fertile. The less Shao Yin instrument we have, the less time we have. So we need to preserve it and nurture it, not ruin it. And this is really how I explain it to patients. That's what needs to be done. Even if you're 40, the doctor tells you you're out of time, this is how we buy time. We make the Shao Yin instrument stronger. We don't ruin it.
Don't do anything, do the right thing. No hagas nada, haz lo correcto. ¿Eso qué quiere decir? Quiere decir que compramos tiempo. ¿Qué es lo que significa comprar tiempo o cómo podemos comprar tiempo? Simplemente aumentando la unificación de nuestro instrumento Shao Yin. En cuanto más recargamos nuestro instrumento Shao Yin, más fuerte hacemos a nuestro instrumento Shao Yin, y cuando llegamos a la ovulación en caso de una mujer, ese Shao Yin eje, esa separación, esa escisión que hay dentro de esa escisión, pues evidentemente esa fuerza de esa unificación también está intrínseco, está dentro de ello. Cuando está dentro de ello, también el embrión, que desde el primer día necesita de esa energía Shao Yin para poder hacer circular esa energía hasta que tenga su propio vaso para poder sobrevivir, es decir, que cuando ya salga de la matriz uterina, pues también aumenta las posibilidades de poder llevar a término un buen embarazo. En ese sentido, pues es muy importante que, aunque la paciente tenga 40 o más años, sea agresivo, pero no agresivo en el sentido que haciendo las cosas equivocadamente, haciendo reducir cada vez más su instrumento Shao Yin, y evidentemente la medicación, porque a veces también puede ser adecuada esa medicación, es correcto, pero si ya hacemos una parte, digamos, 5, 6, 7, 8, 9 ciclos de medicación con reproducción asistida con esa medicación intrínseca, pues en vez de aumentar esa capacidad de recarga de Shao Yin, pues estamos reduciendo nuestro instrumento y estamos reduciendo nuestro tiempo. ¿Qué significa? Fortaleciendo nuestro instrumento Shao Yin hace que compramos tiempo. Cuando compramos tiempo, compramos salud. Cuando compramos salud, compramos más fertilidad. Nos hacemos más fértiles y más capaces de recargar, o la capacidad de recargar nuestras energías se aumenta, digamos, proporcionalmente. En ese sentido, lo que queremos nosotros con las plantas que usamos muchas veces, fortalecer ese movimiento que hace que el instrumento Shao Yin entre en unificación y no tanto de que salgamos a separación. Esta separación también se puede conseguir muchas veces con la medicación equivocada, también con plantas equivocadas. Estimulando con drogas, o plantas, puede hacer decrecer este eje Shao Yin, y hemos de unificar lo que aquí ya también escribe el Dr Seidman ahora mismo. Hemos de incrementar ese aspecto de aumento de capacidad de recarga en cada aspecto de nuestra vida. Y eso es la información, digamos, tal vez más importante que hemos de transmitir o que quiere transmitir el Dr. Seidman a ese nivel. Es decir, que ser agresivos, sí, con nuestra salud, pero no de cualquier manera, ¿no? Es decir, que resumiendo otra vez, don't do anything, do the right thing. No hagas nada, haz lo correcto. Well, we just go on a little bit more in this aspect. So, dear Dr. Seidman, how comes that the success rates after several accumulated ART cycles, more than 8, are about 80% due to the German IVF register from last year? If we contemplate it from our Hunyuan medicine kind of view, each cycle with ART drugs reduces the Shao Yin energy and its ability to recharge, which leads to less fertility. How can we explain this apparently contradictory clinical outcome rate from a Hunyuan point of view? Estimado Dr. Seidman, ¿cómo se explica que la tasa de éxito en los ciclos de reproducción asistida se dispara hacia los 80% después de realizar varios ciclos, más de 8, lo cual se conoce como éxito después de unos ciclos acumulativos, según el registro alemán de IVF del año pasado? Si lo contemplamos desde el punto de vista de la medicina Hunyuan, cada ciclo reduce la energía Shao Yin y por ello la capacidad reproductiva. ¿Cómo se puede explicar esa aparente contradicción de resultados clínicos desde el punto de vista Hunyuan?
Well, I don't recall what paper you mentioned that it was published, but I think you said it was published in some German paper. I'm not sure about these numbers. 80%, I can only share my own experience, treating more than 1,000 IVF patients during IVF. And I can tell you that many patients who do multiple cycles don't get pregnant. Many patients. And I don't know exactly the percentage, but I can tell you that at one point I did study one IVF clinic's charts for the entire year. I took 400 patients' chart and I studied them for one reason, for my doctoral program, for something, and only 25 patients went home with a baby at the end. So 25 patients out of 400 is definitely not 80%. But I can tell you there's in America, maybe we're going to call it some way cooking the books or cooking the numbers, but I can tell you that many patients who do multiple cycles, their energy is decreased. It is decreasing every time they do it. And sometimes patients do get pregnant at the 6th or 7th or 8th IVF cycle. It does happen. But this is rather more the exception and not the rule. If you say 80% get pregnant, that means that's the rule. Everybody who does 8 cycles get pregnant, which obviously is a false number. But it is an exception. And the reason that this exception happens is because what we call in Hunyuan medicine the power of the heart. And I just want to share with you a short story from me many years ago when I was just a student, beginning student in Chinese medicine, more than 20 years ago. I already studied reflexology, which is like a foot massage. I did foot massage, and I remember I had a patient for reflexology, for giving her massage, maybe 22 years ago, I think. And she had the kidney failure, and she was doing dialysis, you know, like filtering the blood, the whole blood every day with a machine. And she didn't have a period for about 5 years. And I gave her a foot massage. And the same day she got the period for the first time in 5 years. And I was a complete beginner. I didn't know anything. Just by a chance, I was pressing on the foot and she got the period. So of course at the time I felt really good about myself. But in reality, many years later, I know that that wasn't really up to my foot massage that she got the period for the first time. But rather whatever was in her heart, that she believed that this guy from Israel that came to New Zealand could do something, that all of a sudden it happened. So this is what we call the power of the heart. And this, after another example, is of patients who did many IVF and ART procedure, didn't get pregnant. Then they go and adopt a child, and all of a sudden they get pregnant on their own after many IVF cycles that didn't work. How is that possible? Because the heart changed. Something changed in the heart, and this is a very powerful thing. And this is really the exception of the rule. At the same time, I would tell everyone that don't count on it. This is really not what happened 80% of the time. The more drugs you do, the more you ruin the Shao Yin, the more difficult it is to get pregnant. Even though on occasion it can happen. That's why I think knowledge is very important. You need to calculate it before what you're doing, the actions that you're doing, and not count on this kind of a study which is all fabricated, and the numbers simply are not true.
Okay. Según la experiencia de Dr. Seidman, simplemente esto lo llaman en Estados Unidos cocinando los libros o maculando un poco las tasas. Según él no sabe exactamente de dónde vienen estos números, o por lo menos duda acerca de la veracidad de esos números. Lo que él puede constatar después de haber tratado más de 1000 pacientes de reproducción asistida es que la realidad es que en la mayoría de los pacientes sí que tienen una merma importante en su salud, es decir, que la capacidad de recarga del instrumento Shao Yin cada vez con cada ciclo se reduce más, es decir, que no solamente reduce la capacidad de fertilidad, sino también reduce la capacidad de regenerarse uno mismo, por ende la salud. Y él también ha estado trabajando en una clínica y ha visto que después de 400 ciclos que había visto por ahí, que solamente la tasa de baby take home rate, o lo que llamamos aquí en castellano la tasa de bebés nacidos en casa, era de un 25%. En ese sentido, de esos 80%, pues no se sabe exactamente de dónde viene. Eso no quiere decir que hay algunas mujeres que después de 6-7 ciclos o más ciclos sí que son capaces de obtener un embarazo y de llevarse un niño a casa. Pero eso no es la regla, sino la excepción. Es decir, que no podemos tomarlo como una regla. La regla, en realidad, aquí se remite a que cada paciente que ha hecho varios ciclos de reproducción asistida, pues ha mermado su instrumento Shao Yin y la capacidad de recarga, digamos. ¿Qué es lo que ha cambiado cuando después, o qué es lo que hace que una mujer que incluso con varios ciclos de reproducción asistida es capaz de generar un embarazo y de generar, digamos, de tener un niño? Es el cambio o la fuerza del corazón. Dr. Seidman, pues quiere compartir ahí una historia con nosotros. Cuando él empezó a estudiar medicina, pues ya hace unos 22 años, estuve en Nueva Zelanda haciendo reflexología. Es decir, que reflexología quiere decir que solamente es como un masaje podal en los pies a una paciente que con enfermedad renal en diálisis, y pues que no tenía la regla durante 5 años. Entonces él era justo un principiante en ese método de reflexología y le tocó algunos puntos así simplemente que tampoco sin saber muy bien lo que hacía. Y el día siguiente pues le bajó la regla después de 5 años. contemplándolo desde el punto de vista, desde hoy, pues dice que claro, que no era su masaje, sino era la capacidad del corazón de esta mujer, que decía, mira, este chico que viene de Israel aquí a Nueva Zelanda, pues ha creído en que es posible ese cambio, que esto puede ocurrir. Y es ese poder del corazón, que hace que un cambio sea posible. Pero hemos de ser conscientes de que aquí, volviendo un poquito a los ciclos de reproducción asistida, eso no es la regla, sino más bien la excepción. Pues yo quisiera preguntarle al Dr. Seidman un poco, que insisto un poco en ese concepto, qué quiere decir, que nos explique un poquito más acerca de ese cambio del corazón. I just want to insist a little bit more. I just posted the question in Spanish already. So just can you explain a bit more about what does it mean? Although you just already gave the example with this girl in New Zealand, you did the reflexology message with the change in the heart. But what does it mean really, change in the heart? And it has to do with the emotion, with the belief that something can happen. As you told, like, all of a sudden, a woman who didn't get pregnant, they adopt a child, and afterwards she gets pregnant in a very natural way. Just want to, if you can say a little bit more about this.
Well, this question, this simple question, in the Hunyuan patients course, I spent about 2-3 hours answering it. So it's a very, very difficult concept, but right now we have just 1-2 minutes. We study in the Hunyuan the meaning of life. How come the body is living? And this is not just the general body, it's every single cell in the body, including the egg, and every cell in the body that is alive. And in order for it to be alive, there is what we call one thread of life. Let me just draw that. We have what we call one thread of life, or this is the male or heaven principle that is inside every cell, that's split outwards. We have this principle, and I'm just trying to jump very, very far ahead. And this kind of emotion, then what we call one thread of life that goes outside into separation, is what makes every cell of the body alive. Now when the heart, and this one, what we call one thread of life, and let me just type it at the bottom here. It's called one thread of life. Is it connected to the heart? That's why the heart is the one that is pumping from the very early time as an embryo. Before you have a heart even, there is already beating. This one thread of life is connected there, and then throughout the life, in the whole vessel, you have this one thread of life that wants to go into separation, and it is connected to the heart and the state of mind. So when, to the contrary, when the doctors tell you, for example, you're too old, your eggs are too old, and it goes into suppression, there is a great physical difficulty there to accomplish any fertility or new life. And vice versa. When all of a sudden the heart changes and the person either doesn't want to get pregnant anymore, she's not anxious about it, you already have a child from adoption, and now the heart is calm, that this we call a change of the heart, that physically things start to change in the body, and this can happen in a very rapid way, to be positive or negative. So just, in a very scant 1-2 minutes that I have, I'm trying to explain this huge concept. This is what it means, a change of the heart. A change of the heart actually impacts every cell in the body, and the bigger the change, the more instant the impact is. Like with that woman in New Zealand, all of a sudden the cycle comes within a day. So for 5 years, all Western medicine couldn't bring the period. And I'm just with a foot massage. It has nothing to do with the foot massage. It has to do all of a sudden with the power of the heart that can impact many different departments in the body. And this is really as much as I can explain in this very brief time that I have.
Bueno, es un concepto que en el curso para los pacientes pues lo explica durante 2-3 horas, es decir, que tenemos aquí un tiempo un poco reducido, y en ese poco tiempo pues vamos a intentar a desentrañar un poquito lo que significa esa cosa un poco misteriosa, ¿no?, que podríamos llamarla así. Cuando hablamos del poder del corazón, estamos hablando de un hilo conductor o un hilo de vida que cuando vemos aquí el círculo, pues vemos que este hilo de vida creado en el corazón, pues es como un corazón. Si cogemos el binario, digamos que no, la emoción, una emoción negativa, una emoción positiva, es decir, que ese corazón es capaz de crear un estado de calma, de serenidad, de positivismo, de creer en algo, que algo es posible, que pueda ocurrir. En ese sentido, si una mujer recibe una noticia y dice que tú eres demasiado vieja, que tus óvulos no valen, pues puede tener un impacto muy negativo acerca de ese hilo de vida que realmente conecta con nuestro corazón, con nuestro primer, digamos, el primer latido, el latido embrionario, el latido del corazón, que es algo que remite a algo muy, muy antiguo. En ese sentido, cuando se genera o cuando se puede generar este cambio a nivel de corazón, impacta realmente en todo o a todas nuestras células, y ese cambio puede generarse de golpe, es decir, que no hace falta que estemos ahí esperando durante años y años. Puede generarse, como ya hemos dicho anteriormente, de que a una mujer que con un historial clínico de infertilidad durante muchos años, cuando adopte y de repente pues se queda embarazada de forma natural. En ese sentido, pues hemos de tener el conocimiento de que ese cambio pueda generarse de forma muy rápida, y cuando se genera este cambio, pues impacta a todo nuestro cuerpo físico, psíquico y todo celular. Y eso es lo que le pasó a la mujer en Nueva Zelanda, que durante años, pues desde el punto de vista de medicina alopática, pues intentaron que le bajase la regla y no hubo oportunidad. Pero el Dr Seidman, cuando estaba ahí practicando sin realmente grandes conocimientos, pues era ese cambio de corazón dentro de la mujer que originó que le bajó la regla. Y eso no era la reflexología, sino que ese cambio que se produjo en el interior del cuerpo, que impactó de forma muy profunda, muy interna. Muy bien. So just going a little bit further on with the concept of time, or insisting a little bit more in this aspect, a bit more, what does it mean really when the RA says to a patient, you don't have time? Insistiendo un poquito más en ese concepto de tiempo, ¿qué es lo que significa cuando el ginecólogo le dice a la paciente que no tiene más tiempo?
Well, we mentioned that before already, but basically summarizing it with one sentence, it means the RE doesn't know what he's saying. That's what it means. Time, this concept of time, has to do with how much Shao Yin energy or Shao Yin instrument the patient has. The more she has, the more time she has. The less Shao Yin instrument, the less time she has. This is really what it should mean, but of course the RE doesn't know that, and he just say to press the patient into the corner to do some aggressive measures, donor egg or IVF or whatever it may be. But in reality, that's what it should mean. And when the patient knows that, then they do things that increase unification and increase their health, increasing their health by time. Decreasing their health loses time in double speed. That's what it means.
Okay. Simplemente quiere decir que el ginecólogo no conoce el concepto del tiempo, no sabe lo que es. Para nosotros el concepto del tiempo es cuanto más recargamos nuestro instrumento Shao Yin, más tiempo ganamos, más fertilidad ganamos y más capacidad de recarga de energía tenemos. Y eso es lo que significa tener más tiempo. Cualquier cosa que incremente nuestra salud, cualquier cosa que incremente tu salud en general, y en ese sentido no me refiero solamente con plantas, sino que en todos los aspectos de vida, aumenta tu tiempo, hace que tu salud se fomente y se fortalezca. Cualquier cosa que reduzca el tiempo, igual a salud, digamos, hace que se reduzca la salud, y eso es lo que significa. Seguimos con las preguntas, ya nos quedan menos. We're just following with the question. There are still a couple of questions to go. So many fertility patients also ask us, how long do they have to be on herbs and acupuncture treatment? Definitely, how long do they have to do a treatment? Since many of them Many of the patients who come to us have been in protocols with ART cycles, and sometimes they only last about 6 weeks. I do refer there to one ART cycle itself, not as a whole, because there are patients who can be in treatment for 4, 5, 6, 7 years, and they have a history of many cycles in a row. But let's say just like it's a patient who just wants to have or has just one cycle and comes to us and said, yeah, look, how many time really do I have to do I need to be under treatment in order to achieve a result, to build a good healthy instrument in that case. So when we tell them sometimes that they have to be on treatment for about 3 to 6 months or even more time, they don't really seem to understand what we're talking about. And as fertility has to do a lot with frustration, anxiousness, and also with economic and social aspects. So how can I afford the treatment for 6 months whatsoever? My girlfriends, my sister, she got pregnant without doing anything, stuff like this. So it seems sometimes when we tell them that they have to be on treatment for this period of time, they say, on top of it, that I'm not healthy because the RA says, yeah, I mean, after the diagnosis probably said, yeah, look, you're 38 years old. Yeah, you have to consider all this aspect of time. We've been talking a lot in this interview. And then we tell them, and he said, now you have to move on quickly, and you have to do this ART cycle as soon as possible because you're running out of time. So then we come there and we say, just stop. You have to be on treatment for about 3, 6, or 9 months, or even up to a year, depending on the physical and psychological situation of the person, in order to build a good Shao Yin instrument, and in order to come closer to the goal, which definitely doesn't mean really a pregnancy. We are not like gynecologists who just probably consider the pregnancy itself. But in Hunyuan medicine, as soon as I know, we're very, very considerably concerned about the future generations also, not about only about the health of the mother and the growing fetus, but about the possibility of enhancing the future generation. I just wanted you to have a couple of words of this. I know a little bit long question, but muchos pacientes en fertilidad que vienen a nosotros nos preguntan cuánto tiempo hemos de estar en tratamiento, cuánto tiempo hemos de tomar las plantas, cuánto tiempo hemos de hacer acupuntura, ya que muchos de ellos están acostumbrados de los ciclos de reproducción asistida. Me refiero ya a un ciclo en general que dura unos 6 semanas como mucho, y eso no, digamos, deja fuera a los pacientes, evidentemente, que pueden haber tenido varios ciclos ya y llevan años dentro digamos, de este círculo de querer ser madres o padres, en definitiva. Pues aquí me refiero a una persona, a una mujer igual que ya empieza con un ciclo o ya ha hecho el primer ciclo y luego quiere una evaluación. Nosotros a veces se angustian cuando les decimos que durante 3, 6 meses o incluso más tiempo se han de tratar. Pues evidentemente hemos de tener en cuenta muchos aspectos. A veces la frustración, los aspectos socioeconómicos, cómo puedo permitirme un tratamiento de 3, 6 meses. Mi hermana se ha quedado embarazada de una forma natural, mis amigas también, y etcétera, etcétera. Entonces, primero les decimos que han de reforzar su instrumento Shao Yin para poder ser más sanos y de esa manera también recobrar más fertilidad. Porque evidentemente lo que a nosotros no nos interesa solo es el embarazo en sí, sino que nos interesa que la madre esté sana, que el embarazo siga en curso y que también adresamos ahí hacia las futuras generaciones. Simplemente quisiera que el Dr. Seidman pues explicase un poquito en torno a esa situación.
Okay. Well, Thank you for this question. Just maybe 2 days ago, I had a patient here sitting in front of me, and we were talking about she's doing drugs and procedure, and at the end, she came with a question that was really right on. She said, "If I were your daughter, what would you recommend me to do?" And this is really the way I see things. It's not like I have an opinion, they have an opinion, everybody has an opinion. I really take it as a personal issue, right? As if it's my family. What will I do? And for this, I really think that the most important is to have knowledge. If you have knowledge, it's harder to do mistakes. If you don't know, it's easier to do mistakes. So, and this I tell my patients very often too. I said, and I'm sure most doctors don't tell patients this, and they should. They tell patients, whatever, that's what I tell my patients. I said, whatever soup you're cooking, you have to eat it. Not me as a practitioner, not the RE is going to eat the soup. The patient that takes the drugs or the herbs or whatever you do, you're the one that has either to take the prize or to pay the price. And this, I think, and this is how I see myself as a patient. This is always at stake for me, for myself. If I do something, if I take drugs, if I need to give the drugs to my kid, I know that they have to pay the price, not the doctor. The doctor is his job, his business to give you medicine or whatever. But your job is to find out as much as you can, to have more knowledge, to contemplate this issue, and to try to find in your heart what's the right thing to do. Now, answering your question, the doctors put the patient under pressure. This is known. Everybody knows that. They tell them you have no time. Everybody knows that. You have to do this and that procedure. Everybody knows that. But really, at the end, the actions that the patient is taking, whatever drugs, procedure she does, she will have to bear the consequences. And this, I'm afraid, nobody is telling patients. Like everybody assures them, I'll give you herbs, I give you drugs, that's fine. I'm the professional, but it shouldn't be like this. I'm very, very worried personally, when it comes to myself, and likewise I'm very worried when it comes to patients. So what I do ask patients is to get as much knowledge as possible what is really at stake. And this we talk about some today already in this interview. What does it mean to increase the Shao Yin unification on multiple levels? What does it mean to do things to decrease it? So I'm not sure, the question was very, very long, but tell me if I answered it or not. This is what I think patient needs to do, is to find...
No. I think the question is pretty much answered. Just a little bit. I mean, how do you cope when you take a new patient, you see that the problem maybe costs about at least 6 months. You explain the concept of time to the patient, or you explain the truth to the patient. That's, ¿no? Cuando le pregunto al doctor.
Right. So, go ahead. Yeah. So the question, the bottom line of the question is why explain to the patient that it takes time actually to do the right thing, and the quick thing is not necessarily the right thing. So this is something, again, that the patient needs to understand. It's not about me. It's not about the RE. It's not about the IVF. It's her body here at stake. Not her friends, not the people around her. Only the one that injects herself with the drugs is the one to carry the responsibility and the consequences. So the patient herself, not her family, not her sister, not her girlfriend, need to tell her what she should do. Only the patient is going to pay the price. She is the one that needs to have the knowledge. What's the right thing? What's the wrong thing? And again, I'm not saying that IVF is wrong. It's definitely abused, meaning used too much when it shouldn't. But at times, like I have a patient now that lost both tubes, IVF is the only way to get pregnant, and I'm completely for it. She should do IVF and try to have a baby. But that's different than pressing the patient to do another cycle and more drugs, what we call an abuse, not the use of the IVF. So the patient has to be very cautious, not never to use it. She can use it, but need to be more calculative. I need to get a lot healthier to see if this will work. And I want to share with you a short story, if I may, about my little kid, a 2-year-old who had some skin infection just a couple of weeks ago. And as a routine, I take him to the doctor, the pediatrician, to look at the skin. It's very inflamed. The doctor said, well, it looks really bad. I'm sorry I don't have a picture to show you. It did look really bad. Something he got in a hotel, some infection. And we need antibiotics, to take antibiotics and put antibiotic cream and maybe some steroid cream also. And I went back home and I said, all what I need is one chance. I don't say Western medicine is wrong. I only need one chance. So I took herbs. I did herbal bath for 2-3 days. It was all gone. No antibiotics or anything. And the story, the real story is that last week I got a letter from the pediatrician firing me. She said, for 6 years you never listened to me. So she said maybe ask another doctor to help her. But the truth is that after 3 days, not 10 days of antibiotics, not 2 weeks of treatment, after 3 days the problem was solved. And this is really what most patients should ask themselves when it comes to fertility. We know there's IVF, we know there's surgeries, we know there's aggressive measures. I only need one chance to get healthier first. You know, that's what I need, one chance to get healthier first and see if I can get pregnant like this. Because this is the best bet, to get pregnant, to get a healthy baby, to get a healthy future generation. So a little bit of time, if it's 3 months, 6 months, 9 months, shouldn't compete with this illusion of it just take 1 month, let's do something aggressive. Need to have the right knowledge, the right mindset. What needs to come first? The patient needs a shot, needs a fair chance at getting healthy first. That's what I think.
Okay, I try to resume it. Vamos allá. En primer lugar, quería compartir un hecho con una paciente que ha tenido hace un par de días, que se plantó en la clínica diciendo, mira, pero ¿qué le recomendaría si, o qué es lo que le diría si fuese su hijo o su hija? Y eso nos remite otra vez al inicio de la entrevista. En realidad, eso es un comentario que yo añado a ese nivel, que contemplamos a los pacientes como a nuestros propios familiares y no hemos de considerar lo que dice fulano o mengano, podemos decir de alguna manera. Realmente, si yo cuezo la sopa, cocino la sopa, me la como yo. Es decir, que todo respecto a lo que ocurre dentro de mi propio cuerpo, con lo cual he de ser, digamos, consciente de todo lo que yo haga para incrementar mi instrumento Shao Yin me va a llevar a un estado de más salud, de más fertilidad. Todo lo que hago en contra, digamos, va a hacer decrecer ese instrumento Shao Yin. Y en ese sentido, hemos de poner a escrutinio otra vez qué es lo correcto, qué es lo no correcto. Evidentemente, una mujer que no tiene trompas, pues el Dr Seidman es el primero en ponerle en manos de reproducción asistida. Esto es un caso, digamos, ya extremo. Sin llegar a esos extremos, eso no quiere decir que no recomendamos en absoluto procedimientos de ciclos de reproducción asistida. Pero lo más importante es que si una paciente realmente quiere entrar en estos ciclos de reproducción asistida, ha de ponerse sano. Primero, en primer lugar, ha de poner o ha de incrementar esa capacidad de Shao Yin, ha de ganar más tiempo. Cuando ya gane más tiempo, cuando ya esté más fuerte, también posiblemente ese ciclo, en caso de que ella quisiese recurrir a ello, pueda tener más posibilidades de éxito. Simplemente, pues en ese sentido, creo que pues ya, si contemplamos que desde nuestro punto de vista los pacientes estén 3, 6 o 9 meses en tratamiento, han de comprender lo que están haciendo es comprar tiempo, comprar salud, ganar en salud, ganar en calidad de vida, y no solamente compararlo con lo que sería como un tratamiento a corto plazo, que son los tratamientos de reproducción asistida que pueden durar un ciclo, unos 6 semanas, pero que en la mayoría de los casos lo que hace es que se reduzca el instrumento de Shao Yin y que se reduzca, ¿no?, ese tiempo, ¿no?, de lo que estamos hablando. Pues ya llegamos casi al final de nuestra entrevista. We're reaching the far end of our interviews. A couple of questions still to go, and then we're off. So here's another very common situation. Woman with good response to Western medicine ART treatments produces good egg quality, no male factor, and still doesn't get pregnant. We know this situation as unexplained infertility. The RE investigates still with autoimmune disorders, genetic tests, and so on, but everything is normal. So, Dr. Seidman, what's in your opinion, or why, in your opinion, can't she get pregnant? Otra pregunta, digamos, interesante, una situación muy común, mujeres con buena respuesta ovárica a los tratamientos alopáticos de reproducción asistida, buena calidad de óvulos, no hay un factor masculino y aún así no hay embarazo. Esa situación la conocemos como infertilidad idiopática. El especialista sigue investigando, por ejemplo, con diagnóstico genético, preimplantacional, etcétera, etcétera, con test de autoinmunes, pero sin encontrar nada en concreto. Entonces, doctor Seidman, en tu opinión, ¿por qué no puede quedarse embarazada?
Well, I mean, first of all, Western medicine can only see the physical body. That includes the egg, and if it fertilized, they conclude that it's good quality. If it doesn't fertilize or has fragmentation, they say it's not good quality. But in reality, quality of the egg means how much Shao Yin pivot or Shao Yin unification instrument the egg has in it, and Western medicine can't see it. So the doctor's conclusion that the egg quality is good is not within his authority. They can't tell if the egg is good or not. Oftentimes, from my experience with patients here in the United States, they do fertilization, they look at the embryo looks great. They do even genetic testing and it looks normal. And then they transfer it and the patient is not pregnant, then they say the egg quality is bad. Before the transfer, they said it's great. After the transfer, since it didn't work, they conclude it was poor. And this, of course, doesn't make sense to me at all. In reality, the quality of the eggs come from the Shao Yin pivot. And the more Shao Yin unification a person has, the better the egg quality is. And this is really the main reason behind most infertility, including unexplained infertility, which is half of the patient, and most of the other, yes, explained infertility. The Shao Yin pivot being weak is the reason. Even if they say it looks like you have endometriosis, it's not the real reason. The Shao Yin pivot, that's what it takes to make a new life, and making a new baby is not another body, it's making a new life, and that's why we need this instrument, the Shao Yin instrument. So this is really what patient needs to have in their mind. It's not like that they've checked all the physical part, everything looks normal, it's unexplained. What does it mean unexplained? Unexplained means I don't know. What kind of a diagnosis is this? I don't know diagnosis. It rather means there is another half to the story. And that other half of the story, it means this pivot fire. We need to understand this topic. And if patients understand this topic, I think many problems will be solved.
Bien, pues aquí otra vez nos remitimos al instrumento de Shao Yin, a la calidad del óvulo. ¿Cómo se mide esa calidad del óvulo? Es muy difícil medir esa calidad de óvulo. En ese sentido, el Dr. Seidman da ahí un ejemplo, por lo menos de Estados Unidos, que es algo muy común, que miran el embrión fertilizado antes de la transferencia y dicen que es de buena calidad, todo bajo microscopio bien que está bien, hacen un test también de preimplantacional y todo es perfecto. Luego, una vez transferido, no hay embarazo y luego dicen que la calidad del embrión, es decir, evidentemente del óvulo, no estaba bien, lo cual no hace sentido en absoluto. Hemos de ser otra vez conscientes de que la calidad del ovular, la calidad ovular del óvulo, esto es el instrumento Shao Yin. Cuanto más fuerte está el Shao Yin, el eje, la escisión de ese fuego de Shao Yin también se hace más fuerte. Entonces, en Hunyuan, en la medicina Hunyuan, pues contemplamos ese aspecto que es un aspecto fundamental. Quisiera aprovechar a hacer una pregunta también acerca del factor masculino, ya que por lo menos aquí en España, en todos los tratamientos de fertilidad, el hombre es el gran digamos, ausente, gran desconocido, y un andrólogo, amigo nuestro, de una clínica con la cual también estamos colaborando, dice muy acertadamente detrás de cada espermatozoide hay un hombre. ¿Por qué? O, ¿Por qué, por lo menos aquí en España, no sé cómo es la situación en Estados Unidos, realmente se deja de lado el factor masculino? Solamente se coge el esperma, se capacita y luego ya es apto para el uso en los ciclos de fertilización. I just want to take profit here and just to make a little question about the male factor. At least here in Spain, the man is just sometimes very just the forgotten factor. You know, it's just I take the semen, I make capacitation of the semen, and I forget about the rest, and now it's perfectly well. Just a friend of ours who we're working with together is andrologist. He says behind each spermatozoid there is a man, so he has kind of a holistic vision behind this. No? But this is not the rule, it's just a far exception, because mostly none of our patients, or very few of them, have a real like treatment, even though they have normal seminogram. But even more, if they have a bad seminogram, they never see anybody. Just they take the semen, they make the capacitation, they forget about it. What's your opinion?
Can you specify the question again? Like, what's the problem in male fertility? Is that the
what's the problem in male fertility, which also could be a question, but rather than what do you think about, like, at least here in Spain, I don't know the procedures in the United States, when a couple comes to a fertility clinic, they completely obvious the male factor. So if he has a male factor like OT syndrome, they just take the semen, just like make capacitation of the semen, they forgot about the man. And also sometimes when they say, no, I had a treatment like with an acupuncturist or with an naturopathist, and even though there is a male factor, only the woman got treatment. So I just wanted to, if you feel like, just to have a word about this situation.
Yeah, well, the thing is, and this is a very interesting question. We have very short time to answer, but you know, the male reproductive cycle is very different than the female. The male supposed to ejaculate his pivot. That's what happened when male ejaculate the sperm. So the nature of the sperm is very different than the egg. The egg is not being ejaculated outside the body. It's kept inside the body. But because it is kept inside the body, that's where pregnancy happens, and all the female reproductive organs, which are whole issues with the uterus and uterus lining and hormones and ovaries and tubes. There's a lot of physical things, because the female belongs to what we call the earth principle. Like all the physical body has to be there. The male pivot that goes outside of his body go into the female body to create conception. But in reality, the energy, the potency that is in the male sperm is tremendous, because it has all the heaven principle of separation that goes inside the female body. But the physical body that served the pregnancy is the female body. And that's why Western medicine, because it's a physical kind of medicine, really have to do with the female body. They can only analyze the physical tissues that they can see. The male part of getting pregnant is like 99.9% energy or life force. It's not this little piece of sperm. It's rather all the life force behind it, but Western medicine doesn't put its hands around it. Remember, the first half of the story, they don't know. And the male sperm and the energy behind the male sperm and all the spirituality that comes behind it, etc., is completely part of the first half of the story. And that's why Western medicine, even though you have a male factor, they said, okay, well, just take your sperm and we inject it in the egg. But all the treatment, the drugs, stimulating the egg, that's the thing. They can deal with the physical body. The sperm, in reality, when it is being discharged from the male, it's already outside of his body. There's nothing you can do to his body. The sperm is out. Versus the female reproductive organs, it's all there with the pregnancy and the egg. It all stay there, so we can manipulate it and do surgeries and laparoscopies and, with the female body. But that's really the main reason. The Western medicine is missing all the energy part, the life force part. If they had this kind of medicine, of course, men will get much more treatment. Like they will strengthen the pivot of the man, but right now it's not. So that's why the focus is always on the female. With the female, you can do a lot of procedures, even if it's not necessary, even if it's not her problem. With her, you can do procedures. So for me, this doesn't make any sense whatsoever. And in Hunyuan, again, we scrutinize it. We don't just want to work with the clinic, get business from the clinic,
so in this kind of sense, when we have that sperm, does this refer in just in a cases that could be like the Shao Yin instrument, which is also the fire pivot, the heart pivot. There's like the spiritual aspect, also like kind of miss or lack of discharging of this Shao Yin pivot.
Let me just explain on this. So we don't have much time. All right, so let me just explain on this just for a minute. So we don't have much time to go into it. Your mic off. So we don't have much time. In the patient's course, I talk a lot about it. But the female pivot is this kind of a pivot that stays inside the body. So this is the egg, the ovum. The male pivot is of a different nature. The male pivot is a heaven pivot. It's split out like this. And this is the sperm being ejaculated outside the body. So to understand it, of course, we need to contemplate our Hunyuan medicine, and then we know what needs to be done. So we do need to strengthen the Shao Yin pivot of the male, but it's different than the female. It's not exactly the same because the principle is different. This is the male principle to
just
separate
wanted to make sure for
the
our audience
body,
they catch up this difference.
The female doesn't ejaculate the egg, it stays inside the body. It has the earth principle.
Respondiendo a la pregunta que le he hecho al Dr. Seidman, ambas situaciones, digamos, la fertilidad masculina y la fertilidad femenina tienen una vertiente común, que es el eje Shao Yin, digamos, el instrumento Shao Yin, pero hay una diferencia fisiológica, es decir, que el hombre eyacula su eje de Shao Yin hacia afuera, el esperma está eyaculado hacia afuera, mientras que el óvulo, aunque está, digamos, descargado, pero se queda dentro del cuerpo. Por eso la mujer se considera el principio de la tierra, o está, como digamos, sujeto a ese principio de la tierra, donde ese embarazo ocurre, y por esa razón también ese embarazo no puede ocurrir fuera del cuerpo, es decir, que el hombre eyacula fuera del cuerpo y el hombre no es el que lleva un embarazo. En ese sentido, ese eje o esa escisión del instrumento de Shao Yin, una vez que es cargado hacia afuera, pues también tenemos que tener en cuenta ese principio, que es ligeramente distinto que la de la mujer. El hombre pertenece al concepto del cielo, y ahí cielo y tierra, evidentemente, que también se podría considerar como algo yin-yang, y hemos de adresar también el tratamiento debidamente. La capacidad, la potencia dentro de ese concepto, digamos, del cielo, el semen, hay un concepto muy espiritual detrás, muy energético. El 99,9% de la capacidad, digamos, reproductiva de fecundación de este semen, de esa capacidad, es energético y pertenece enteramente a la primera mitad de la historia. Es un aspecto muy, digamos, muy fuerte, Y eso es lo que quería digamos, explicar el Dr. Seidman aquí también con este círculo. Bien, pues ya hemos llegado al final de nuestra entrevista. Simplemente quiero hacerle la última pregunta y agradecerle la disposición que ha tenido. Pues now we just got to our last question. I just wanted to say thank you for the disposition for this interview. And just a last question. Just have to have a look at it. It's just like, do you want to bring a message of, well, do you want to bring a message of hope to those who are desperately looking forward to become parents? Yeah. Simplemente quería insistir o preguntarle si nos quiere llevar un mensaje de esperanza a aquellos que intenten desesperadamente de ser padres.
Well, I think personally that knowledge is power. What I would ask patients is to try to find out as much information as they can, especially on the first half of the story of life, how life comes about, what does it take to keep it longer, what does it take to keep it healthier, and with that to get more fertility. I think that what I personally do and I recommend to everyone to do is to believe no one. Not chat rooms, not me myself, not other doctors, believe no one, but rather try to contemplate the issues yourself, to try to find out like if it's truthful or not, because at the end it's your health, your body, your life, your babies, your future generations that are at stake. So it's like today everyone is just believing, yeah, the clinic, they have good statistics, the doctor, it looks really nice. I say believe no one. Just try to find out as much information as you can. What's the right thing for you to do? And this is really my recommendation, because my experience shows that when patients know more and they know what the right actions that they need to take and what are the wrong actions that they should avoid, that actually they become more and more successful. So in my clinic, many patients, after they understood it, all of a sudden, not just that they got better, healthier, stronger, they got pregnant and have healthy babies. And this is
Pues
something
resumiendo
that
lo
is
que ha dicho el Dr. Seidman,
an illusion.
podría
This
decir
is something that is
el
real. It's just that
conocimiento es
it needs to
poder.
come out of
En
a
ese
place of
sentido,
knowledge,
también el paciente
not
ha de
out of a
poner a
place of
escrutinio
desperation
todo lo
and
que
desperate acts.
les decimos
So this
nosotros
is
como
something that I
terapeutas, tiene que
think
resonar con
that
su
could help
corazón,
a lot of
aprender
patients.
lo que es
Try to
correcto, lo que
find
es
real
falso, lo que es
knowledge,
verdadero,
and
lo que
with
es
that
falso.
you'll get to the right decision,
No te
how to
dejes
get more
convencer de nadie,
healthier, more
ni
fertile,
siquiera
and
del
then get
Dr.
pregnant
Seidman,
and
sino
have
que
a baby.
realmente deje que tu propia intuición, que tu propio espíritu, que tu propia, digamos, la involucración que tú tienes contigo mismo sea la voz cantante en ese sentido, que te guíe, que sepas discernir realmente lo que te va bien, lo que no te va bien, lo que haga que aumente tu salud, lo que haga que decrezca tu salud, aprende realmente lo que te hace bien, lo que te hace sentir bien y lo que te hace sentir mal. Una vez que hayas comprendido ese aspecto fundamental, también ocurren cambios rápidamente, y eso es lo que también el Dr. Seidman ve muchas veces en su clínica. Una vez que se haya establecido ese tipo de contacto, este tipo de vínculo, pues ya ocurre la sanación y las pacientes y los pacientes son capaces de ser padres de incluso después de muchos años de casos de infertilidad. En ese sentido, tal vez otra vez decir lo mismo, don't do anything, do the right thing, ¿no? No hagas nada, haz lo correcto. Pues quisiera agradecer al Dr. Seidman para esa para tener el tiempo de esa entrevista. Creo que ha sido muy interesante y pues tal vez nos vemos en otro momento. I just want to thank Dr. Seidman for this interview. I think it was very interesting. Probably we're gonna have time or possibility to meet another time. Thank you very much.